My name is Lauren Saloyo.
And I'm Sydney Howard.
And I'm Gabbie.
Our topic is physician-assisted suicide.
Physician to help the patient in ending their own life. So it's different than euthanasia. Euthanasia is really about a medical provider ending the patient's life, where physician-assisted suicide is about the physician giving the tools for the patient to do the act of ending their life. Was before I was in medicine, and there was a particular doctor called Dr. Jack Kevorkian, and he was someone who felt strongly about this, and he actually was involved in euthanasia or physician's assisted suicide. It was illegal what he did, and he ended up going to jail.
Between 52 and 58% of Americans say they approve of Jack Kevorkian assisting people who want to commit suicide. And about 3/4 of Americans, whether they approve of Kevorkian's methods or not, 3/4 of Americans say they believe that a terminally ill person should have a right to assisted suicide.
I think that the Compassion & Choices folks, as good as their intentions are misleading the public. They talk about death with dignity. Let's be clear, they're talking about physicians writing lethal prescriptions.
Brittany Maynard, a 29-year-old woman who was diagnosed with a likely stage 4 glioblastoma. The doctor said she had about 6 months to live. Many people came to know of her when she chose to move from California to Oregon to take advantage of the assisted suicide law.
She ended up moving to Oregon so she could become a resident and then would be able to have the option of the assisted suicide.
She had many supporters around her who stuck with her the whole journey.
This is the first law in the country to allow physician-assisted suicide. It was approved by the voters of Oregon in 1994. It allows terminally ill patients who have less than 6 months or less to live to obtain a lethal dose of medicine from a doctor.
Of the terminally ill person as being seen as somebody who's making a deliberate choice in seeking assisted suicide. And in doing so, they are seen as taking a courageous and a heroic action to control dying.
Physician-assisted suicide is legal in some states. It's legal in Oregon, Washington, Vermont, and there's a form of it in Hawaii. And physician-assisted suicide is you indirectly play a role to intentionally end the life of a patient. Physician-assisted suicide is illegal, but it's a kind of a gray area too.
The phrase death with dignity implies that people who die naturally with hospice care and with good medical care are somehow less dignified. I really worry about the cultural message. Wherever one stands on this, on the legalities of this, I worry about the message that we're sending to frail elders and seriously ill people or people with disabilities, that somehow they're not already dignified, but they are. And their dignity can be preserved in the way we care for them.
People have very strong opinions about physician-assisted suicide, and some people believe it goes against the oath that physicians take. which is not to harm a patient, while other people feel that you're assisting a patient